Good afternoon, Mr. Johnson. My name is Lily Pelici. I'm a nurse practitioner student. Can you please tell me your full name and your date of birth?
Dave Johnson, September 10th, 1992.
So how old are you now?
30.
Okay, great. Do you mind if I touch you? I have to start your examination.
Mm-hmm.
Okay, we're looking at your skin. Your skin is even. It's proper for ethnicity. Looking at your head, it's normal cephalic. I'm going to touch your head. Normally, I have gloves on, but for this video, we're not going to show any. Your hair is evenly distributed through your head. I don't see any missing patches, any lumps or any bumps. I don't see any lices or any dandruff. The texture of your hair is fine. Your beard is full. There are no bumps, no lesion, no masses in there. By the way, did you feel any tenderness when I touched your hair?
No.
Because I don't feel any masses, so I'm glad to hear that. Your beard is even. Your mustache is full. Your eyebrows is full. Your eyelashes are full. Okay. Your eyelids are fine. There are no crusts around them. There is no bumps. There is no lesions around there. There are no scars on your face. Good. So now I'm looking at your eyes. They are symmetrical, as are your eyebrow. As we take a look at it, I'm going to look at your conjunctiva, which means that I have to look into your eyes. And your sclera is white, your conjunctiva is pink. Your mediolateral canthus is fine, no crust, nothing to see there. Your lacrimal ducts are working fine. There is no overflow of tears going on. Your nose is midline to your face. It has patent. They look fine. There is nothing running out of them. We are going to check your eyes. Okay, we're going to start with your eyes. As we are looking at your eyes, the first thing I need you to do is I want to see if you're able to read. So, and if you have a problem with distance or what's going on with your eyes, cover one eye, please. And you're going to read the one line that is you can read the lowest, at the bottom, and the lines that you can read. Read one.
LTFPH.
Okay, switch eyes, please. Cover the other one.
LTFPH.
Okay, and that is 2020. Can you tell me which color? Close your eyes again. Which color is this?
That is green.
Which color is this?
That is red.
Switch eyes, please. What is this color?
Red.
What's this color?
Green.
Okay, great. I am going to look into your eyes. Oh, before I do that, what I want to do is I want to check the muscles around your eyes, your oculomotor. Okay, so we're going to do the CN 3, 4, and 6. All right, so what I'm going to do is we're going to do something called accommodation. All right, and I want to see you to look behind me. Okay, and I'm going to look to see what happens when your eyes, your pupils come with something close to them. Okay, your pupil dilate and they close down, so it's like a near far kind of thing. It adjusted for what it needed. The next thing we're going to do is what's called a consensual test. That means that I'm going to flashlight into your eyes and I want to see how your pupils react to it. Okay. Okay, what happens is that it's called a direct consensual. What happens is one eye constrict when the light hit it. The opposite eye actually constrict also. Okay, so they're both consensual to that. We're also looking at your extra ocular movement. So I'm going to do something that I'm going to do what's called a cardinal, 6 cardinal steps. So I want you to watch me, okay? Watch my finger and follow it just with your eyes. Don't move your head. Okay, and we're going to see some convergence. I want to see what your eyes do when it gets close. Okay, great. We're gonna do what's called a wiggle test. So it's for your visual field. Let me know when you see my fingers.
No.
Tell me how many fingers I've got.
2. One. 2.
Okay. Tell me when you see them.
No.
Okay. Great. Great. Now we're going to check your nose. Oh. I'm going to check inside your eyes. I'm going to check for opacity. I am going to be checking your retinal vessels. I'm going to be checking your macula. I'm going to be checking your disc ratio, the cup disc ratio, as I look into your eyes, okay? I'm going to get close to your face. I'm sorry, but it's going to be the same I am using. Okay, low opacity. Your macula is a little orangey. It's like a quarter centimeters, I mean. Okay, and you see no opacity in there. So that means that I don't have to worry about things like cataracts and glaucoma, so on and so forth. I want to check your ears. Okay, we're going to do a couple of things. First thing I'm going to do is what's called a Weber test. And the Weber test, I'm going to hit this and I'm going to put it on top of your head. When I'm going to put it, you're going to hear a sound. When the sound stops, tell me, okay?
No.
Okay, I'm going to do it. I'm going to do another one. This is a rhyme test. You heard it in which ear? This is the Weber test. Which ear did you hear it in?
This one, both.
Okay, now I'm going to do what's called a rhyme test. I'm going to put it in your occiput back here, and then I'm going to put it next to your ear. I want to know which one is the longest you've heard it. Okay? Tell me when to stop.
Stop. Stop.
Okay, so your ears are fine, okay? Okay, we're going to start with your ears. All right? Your ears, there are no lesions, nothing against the skin. There's no bumps, no scars. Okay, I'm going to look inside. Because I'm using your left ear, I'm going to lift it up, the pinna up and back. If you were a child, I'll be doing it down inside, down and back. All right. I'm going to look in the ear. I see the walls of the ears is pink. I see the hair, little cilious around it. I see some cerumen. Okay. I see your tympanic membrane. Okay. There is no lesions. There is no perforation. And I can see the cone of light at 7 o'clock. Had it been on the other side that I do it, I would see it at 5 o'clock. Okay. When I did the Weber test, it's for sensorial hearing loss. Had you heard on one side instead of the other, then you would have a problem with your hearing. All right. The other one was for bone conduction. Okay, because the Weber test is sensorial. The other one is bone. Okay. Now we're gonna do your nose. Okay, your nose is symmetrical, the nails are fine. I'm going to tip your head back and I'm going to look inside your nose. All right. We're going to look into your palette. Hold on, please. Okay. The walls are lightly pink. There is no, it's moist. There is no deviated in your septum, no deviation. Okay. No bleeding. No perforation. Good. Okay. Now, I want to check something. I want you to close your eyes. I want you to tell me if you feel soft or if you feel sharp. Okay? Whatever it is I touch you, wherever you touch, tell me if it's sharp or if it's dull.
Soft. Hard. Soft. Hard.
Okay. Over here, let me check your temporal artery. It is bounding by +2. Okay. Do me a favor. I want to look at your TMJ. Open your mouth. Ah. Okay. I don't hear any clicking. Okay. All right. Close your mouth. I want to see you move the muscles. I want to see you smile. I want to see your eyes go up and down. Great. Great. I want to check your mouth. Your lips are moist. Okay. All right. The walls of your mouth are moist. There is no lesion that I can see. Okay. Lift your tongue for me, please. Okay. Wag your tongue back and forth. Good. Okay. Let me look at your dentition and decide your lips. Okay. All right. I'm going to go in the back of your tongue. So check your gag reflex. Okay, your gag reflex is working. Your uvula is midline. Your tonsils are on the side. They're pink. They're not red. I don't see any exudate in your mouth. Okay, great. Okay, I want to check your neck. Okay. I'm going to check your thyroid. First thing I'm inspecting. Okay. Then I'm going to palpate it. Check your thyroid. And your trachea. I can feel the rings. Okay. Do me a favor. I want you to take a swallow. Hold on to it. When I touch you, you can stop. Drink it. Okay. Great. No nodules felt. Okay. Your lymph nodes. Let's take a look at your lymph. You finished? Okay. Your lymph nodes. Preauricular, postauricular, your tonsillar, okay, your occipital, submandibular, submental, okay. We have the posterior cervical chain. We have the supraclavicle. We have the supraclavicular here. Okay, I don't feel any swelling over there. I am going to look at your chest. Okay, I don't see any cuts. I don't see any bumps. Okay, now I'm going to palpate your chest. Okay, palpating your chest is doing this. Okay, but while I palpate your chest, you might as well do your firmness. We want to check your lungs. Go ahead. Say 99.
99. 99. 99.
All right, great, great. We're going to do what's called percuss. All right. And I'm going to listen to your chest. Better known as auscultate. Breathe in and out. I want you to say 99.
99. 99. 99. 99.
Okay, thank you. We're going to do what's called an egophony. An egophony is actually what we're really looking for is what's called consolidation. Anything that doesn't sound clear, that sounds too clear, that means that something is allowing it to become clear. So that might be some consolidation, which means that you might have some water or something else, making it easy for this to happen. Okay? All right? 99.
99.
Mhm.
99. 99. 99. 99. 99. 99. 99.
Okay, they're fine. We are going to do what's called a diaphragmatic excursion. What I'm going to do is ask you to take a deep breath and hold it. I'm going to percuss your back, and when we get to a dull area, I'm going to stop and let you breathe out. Then I'm going to ask you to take a cleansing breath, and then just let it go, and I'm going to do it going up, okay?
Okay.
All right. Okay. Take a deep breath and hold it. Okay, now it's dull. Let it out. Okay. Now take a cleansing breath and release it. And I'm going to go back up. Okay. And the difference between the two is about 3 centimeters, which is fine. Okay, it can go up to 8. Okay? We're going to do what's called whisper periloquy. I'm going to use my stethoscope, and I want to hear you say 99.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Thank you. Thank you, Mr. Adam.